I've got Paul Fox here, who's the CEO for Yoga4Health Alliance charity. I don't know if you've heard of Yoga4Health, which is like a 10-week program accredited by NHS. And they also deliver Yoga for NHS staff wellbeing program, which is accredited by the Royal College of GPs. In today's session, Paul will cover the evidence behind yoga, breathing practices, approach to physical practice, and a short yoga practice. I will now hand over to Paul. Thank you, Paul.
Thanks so much. Welcome, everyone. Thank you for joining me. I've been sort of pioneering with our fellow directors at Yoga4Health Alliance and Heather Mason, who set up the whole thing, and she runs a big yoga therapy training school in London. We've been trying to integrate the benefits of yoga into healthcare. We do that through the routes that have just been mentioned. We have a patient protocol, which is superbly evidenced by the Westminster University study of 279 patients, and that was published about 5 years ago now. And then more recently, we've been scaling up as rapidly as we can the staff wellbeing program. And the other thing we do, because we have this kind of program delivery side, and then we also have a sort of public campaigning role where we try to present information about evidence-based yoga and how it can support patient health and well-being, and also staff health and well-being. And so we are the secretariat for the all-party parliamentary group on yoga in society, and 2 or 3 times a year we hold meetings in the Houses of Parliament with experts in their field, and they are able to present their evidence to MPs and peers and policymakers to try and have an influence at that national level. So things we've covered, we did one on prison yoga recently. Before that, we did one on the teenage mental health crisis. And before that, we did one on community sport and how that supports health. So we have quite a broad reach. I've prepared a few simple slides to share with you. And I'm also going to teach you a little bit of breathing to show how we teach breathing, because that really is the most important and the main tool that we offer both patients and staff. And then I'll show you a couple of things you could do with your chair in an office situation. So let's just see if this works. So there we go. I'm sure someone will unmute and tell me if anything's not showing, but I'll assume it is.
I can see it. Thank you.
Excellent. Perfect. So yeah, this is how I'm going to sort of structure the session. Just tell you a little bit about our work. It's really important that you know what we're doing, because the patients are increasingly asking, particularly in primary care settings, asking for the Yoga4Health program, and staff are also asking for the Yoga for NHS staff wellbeing program. We've been quite successful the last few years through organisations like the British Society of Lifestyle Medicine, the College of Medicine and Integrated Health, and other channels to really get our work out there. So it had already started with the 10-week programme back in 2016, when West London Clinical Commissioning Group, the NHS there, put £250,000 into the Yoga4Health Alliance and Westminster University to create the first NHS commissioned evidence-based social prescribing pathway for yoga. And of course, social prescribing has become very important, a key feature of primary care now. And I've watched the landscape change while I've been running the Yoga4Health charity, from sort of very, very little social prescribing going on to now having the link workers, the health coaches in every primary care setting. So we are an early intervention and prevention program. We're lifestyle medicine, and we chose to do that because there are some other quite good interventions for particular things, like there's yoga for healthy lower backs, which is a nice approved intervention, and there are specialist yoga therapy trained people working with trauma, with different more complex medical conditions. But as you know, it's lifestyle related disease, it's non-communicable disease. This is the greatest burden, both of ill health, leading cause of death worldwide, and creates an awful lot of demand within the healthcare system. So we've always had these twin objectives of supporting the NHS by trying to be part of the initiative to get patients to self-care better, to adopt lifestyle medicine, make lifestyle change, sustainable lifestyle change, and therefore need fewer treatments, appointments and drugs. And you really need that with the demographics that we have in this country and other sort of mature industrial nations, where the working population is shrinking and the older population is growing. So you can see there the three main reasons that we bring people into the program. So they'll have some kind of mental health challenge around stress, anxiety. They might be have low mood or mild to moderate depression as well. They are identified as being pre-diabetic, or they have type 2 diabetes, but kind of at a stage where it would respond well to lifestyle change, or they've been identified as cardiovascular risk with a Q risk score of around 10, or they are socially isolated. And we offer a program that can be done on a chair or on a mat, and we have created a standardized protocol which is can be replicated by the teachers we train all over the UK, and that is what is happening at the moment. So just go down a slide. There we go. So I mentioned the Westminster study. If anyone's interested, you can always drop me an email. I can send you the links, or if you just type in Yoga4Health mixed methods evaluation, that study comes up. We've put both the published studies on the homepage of the Yoga and Healthcare Alliance.com website. We were one of those studies which fortuitously every metric that we took went positively in the right direction to an extraordinary degree. So patient activation, which many of you will be familiar with, this is really at the root of patients feeling that they have the skills, the knowledge, the confidence to manage their own health. And there are 4 boxes, and 62% of the patients went up 2 boxes. So that was pretty amazing. There's a great graphic if you dig into the study showing how many people are in boxes 1 or 2, which is a difficult place to be in terms of managing health and making lifestyle change, and then how many ended up in boxes 3 and 4, where people are really actively managing their health in a positive way. We used lots of established scales. Westminster University did. So stress was down significantly, and there were tons of these measures, and all the statistics are great, but I didn't want to overload this with all that. You could always go and look it up. But there was the physical side. I've just done one mental, one cardiovascular there, and we saw this amazing waist circumference reduction by an average of 14 centimeters in just 10 weeks. So it certainly had an impact, and we're not really focused on diet. It was purely the result of people becoming more aware of their bodies, feeling healthy, doing the yoga practice, put a lot of emphasis on home practice, led them to naturally want to eat less, exercise more, and the weight came off for that reason. So since 2016, it's sort of been my role to grow our reach by training up with a couple of other tutors. Now we're over 550. We're aiming for 1,000 teachers nationwide, and these are experienced yoga teachers. And about a quarter to a third of every course, these are yoga teachers who are also healthcare professionals. So loads and loads of GPs, nurses, physiotherapists, occupational therapists, psychologists, psychiatrists, all sorts of people from all walks of life in the NHS have come and done the 60-hour training which is accredited by the Personalised Care Institute, as we can see. Coming up, yeah. And at the moment, so we're increasingly managing to leverage, because of our very good evidence base and impact. So recently, in the autumn, got £15,000 from Sport England. So we're currently delivering to 250 patients. Got 12 courses starting. 10 of those have already started. And these courses are all running in areas of highest deprivation in Greater Manchester. So we're kind of having a look at to whether our intervention could be an effective way of narrowing health inequalities. And the initial, because we take a before and after data, it's looking good, because 42% of patients who are registered on that programme come from households with an annual income of less than 15,000 a year. So it looks like we really have connected with the audience we wanted to. So perhaps of more direct interest to you as NHS staff would be our Wellbeing one, and this is offered absolutely free. That's not a random stock image either. What you've got there is, on the left is Rebecca Lawrence, who's an NHS doctor based down in Croydon, but also quite a well-known yoga teacher, runs yoga retreats around the world. And next to her is Dr. Rupal Dev, who's a consultant psychiatrist, but also quite involved in supporting medics who've gone through more serious mental health challenges. We also have a partnership arrangement with Doctors in Distress, and publicise each other's programs if you've come across them. So again, we're all about accreditation and the evidence base. So we jumped through all the hoops and got the Yoga for NHS staff Wellbeing programme accredited by the Royal College of GPs as CPD. And as I usually say on the first session of the 6 weeks, this is probably going to be the easiest CPD you ever do. Then again, we do ask people and support them with lots of home practice resources, because what we're really trying to do with the staff is enable them to, at the end of that six weeks, feel really confident, particularly about the breathing practices. But again, it's a standardized protocol, so participants get really used to the physical practices and feel more confident about practicing them at home. We also give them a certificate that says they're a breath ambassador. That's a completely voluntary thing, but the idea there is to make it a sustainable program by inviting staff, once they've done the first 6 weeks with us, and then they can do another 6 weeks if they want, to share the breathing practices with colleagues who may benefit. So this typically might be colleagues who are clearly under stress or struggling or finding it difficult to sleep at night, things like that. And we have breathing practices that support and help with that a great deal. So Yoga for NHS came after the patient programme. That came first, and it partly became afterwards because we went round visiting GP surgeries and others and saying, we've got this fantastic patient programme and here's the evidence base, and they say, we love it, please run it for our patients, but what have you got for us? And we said, well, nothing at the moment, but we'll get onto it. So we got onto it, and we've now delivered that to nearly 800 staff. I ran all the pilots for that programme as a volunteer, and was lucky enough to get nominated and win Our Health Heroes Award for my efforts. So that's me receiving it in London last year with Professor Alice Roberts there on the right, who then said she wanted to come on the programme but hasn't done so yet. And I'll just share, we're getting towards the end of this little chat from me. But the evaluation has been very, very good. I've just picked out 3 slides and 2 quotes for you. So have the techniques you've been learning. Remember, this is the staff. have they been useful for stress management? We've got 91% saying yes. Have the yoga techniques made you feel calmer and less anxious? 90% saying yes. And then if we go down to the last one, has Yoga4Health had a positive improvement on your mental health? And got 82% saying yes. We're really happy with that. So when we were designing this program, we had in mind the fact that sickness absence rates on any given day in the NHS is been over 6%, and that's such a big organisation. That's a lot of people, and nearly a third of those who are off sick due to mental health problems, and those are predominantly stress and anxiety. So it was obviously a key area for us to target. I won't read out those two quotes. Maybe just have a quick look if you're interested. We get lots of lovely feedback from staff. And I'm sure this isn't going to last forever, but we have this question in the evaluation, and we're up to about 200 responses now. And the question is, would you recommend this program to a colleague? And we're still sitting at that pie chart is still sitting at 100%, which is remarkable, really. So the next steps for Yoga for NHS, just as in case you might be interested. So I mentioned earlier that the patient program was very well evidenced by these 2 published academic studies by Westminster University. So now we've got the same thing happening for the staff program. So in 2 weeks' time, I'll be teaching the first of 2 courses with 75 of 150 staff who've been selected for the study. So it basically will be taking Westminster University will be taking data from the 75 who are doing the Yoga for NHS staff wellbeing course and the 75 who are not, in order to sort of compare. And that group's obviously been split and randomised in the way that academics do that. So that will hopefully provide a robust academic evidence-based, a published base for the staff program, and enable us to get more funding for it, because funding is a problem. So I mentioned that I got that award for doing it voluntarily. I don't actually choose to be unpaid. It was just we couldn't get anyone to fund that. We've had a few little bits of corporate funding, and we've had 3 NHS establishments now have funded it for their staff. But as some of you may know, the NHS feels very obliged to spend almost every pound it has on patient care, but all the data and what's going on, I mean, they really do need to invest more in staff wellbeing, and we're trying to make that case as strongly as we can. So this is the last slide, and then we'll do a little bit of practice. So I just picked this one to share with you, because rather than going through a load of the actual published research papers, there are well over 800 published research papers on PubMed now which have yoga in the title, and there are over 50 peer-reviewed papers as well, where they take a collection of studies, so it's a much bigger sample. So there's a really good solid evidence base now, and that really wasn't there. There's been an extraordinary growth in interest and in the quantity and quality of research being done in yoga. Professor Satbir Singh Khalsa, assistants, I've got that wrong, he's actually Associate Professor of Medicine at Harvard Medical School, but he's the world's leading yoga researcher. He's one of the trustees of the Yoga and Healthcare Alliance charity, has produced this little, I don't know how to describe it, it's like a flow chart, isn't it, to sort of summarize how yoga works. So it has these 4 domains. So of course, fitness. And a lot of people think of yoga as the postures, the asanas, but it's much, much more than that. But nevertheless, it's an important part of the of a yoga class. And if you go to a gym and do yoga there, it's like 99% of it, probably. So that will improve flexibility and strength, and coordination and balance, respiratory function, self-efficacy. That's great. Self-regulation, we get a little bit more into, particularly autonomic regulation, stimulating the vagus nerve, getting parasympathetic drive to address chronic sympathetic drive and rebalance the autonomic nervous system, and emotional regulation, resilience, equanimity, self-efficacy again. Awareness, so we're doing a lot of mindfulness practice, a lot of attention practice, concentration, cognition and metacognition. And then spirituality, which we don't really teach in the patient or the staff program, but it more sort of comes from that awareness, that heightened awareness and mindfulness, and creating space in the mind and separating yourself from your thoughts a little bit, untangling, and being more aware of the sort of underlying consciousness that there is. Gives people experiences of a unitive state, even transcendence, flow, transformation. It gives them a different perspective on their life. And we see that all the time, without teaching it directly. We see it all the time, particularly with the patients who come through the Yoga4Health program. And that all feeds into global human functionality, improving physical and mental health, physical performance, stress and emotional regulation, awareness, mindfulness, metacognition, positive behavior, well-being, values, life purpose, meaning and spirituality. Okay, so I'll come out of this and we'll do a little bit of breathing and then a little bit of movement. I will leave time at the end for some questions, and feel free to pop any in the chat if you have them. So I'm gonna teach a little bit of breathing using this, what I call the breathing ball. It's just like a children's toy, something you can pick up in toy shops, or actually got this from Wilco before they went bust. It's a really good visual guide to breathing. So just before we start, if I could just invite you to be seated with the feet flat on the floor. If you're in a chair, some of you may be sitting on the floor already, that's absolutely fine. If you're sitting on the floor, just make sure you're supporting the hips well enough so that the knees are level with or lower than the hips, and make sure you're comfortable. And then the second thing is just to bring the length of the spine, let the spine grow. So if the spine is a little bit rounded, we tend to slump, particularly if we have a sedentary job, sedentary lifestyle. We can get weak in the core muscles, they switch off. And it's very hard to breathe efficiently if the front of the chest is closed down. So we want to come a little more upright and feel, if you place the back of the hand on the lower back, you want to feel that your lumbar curve is present. So a really crucial thing is where the pelvis is. And the pelvis is sitting on its rockers. So if you're too far on the back of the rockers, the top of the pelvis is going to go backwards. It's going to take out the lumbar curve, and instead it's going to push the spine into a big C shape where the head is forward of the midline of the body. There's pressure on the intervertebral discs in the lower back because you've lost your lumbar curve. And you need that curve to really stack those discs in a biomechanically sound way. And when you have the three curves going in, back of the neck, out through the thoracic, back in, through the lumbar and back out around the sacrum and the tailbone, when they're all present and the spine is stacked, we call that the neutral spine. So we spend quite a bit of time just conveying that both to staff and patients and just cultivating that. And everybody slumps. You can't hold perfect posture all the time, particularly when you get tired, but this is what we want. So a little digression on posture is really important. And then the other thing is just lift the shoulders and lower the shoulders and give the shoulders a little bit of a lift and roll, because after we've sort of sorted out the spine and got that nice and long and the head more balanced over the top of the shoulders, the other thing that goes wrong is the shoulders are too tight, so they have to be released. So a little shrug just gives you feedback on whether the muscles there are tight or already quite released. So now we're kind of ready to start. So if you don't mind just closing your eyes just for a moment, or having a soft forward downcast gaze if you don't want to close your eyes, and just taking a moment to notice exactly how you are feeling right now. So notice how you are feeling in your physical body. Are you feeling well at the moment? Do you have a cough or a cold? Are you a little bit under the weather, or actually feeling really well? And we're trying to do all this with our mind. We're into mindfulness now, so we're trying not to analyze and overanalyze and make judgments. This is good, this is bad. We're just simply noticing. It's sometimes called witnessing as well. We're noticing how we're feeling right now or in any given moment. Notice whether the body is full of tension, or whether the body is spacious, has more qualities of release, softness. Notice the mind, whether the mind is very active, maybe overactive, whether there's a lot of mind wandering, or whether the mind is fairly steady. And again, rather than analyzing that, just trying to notice the thoughts that are arising in the mind. Observe them with a little bit of curiosity, but also that little bit of distance, stepping back from your own mind, from the thoughts that are arising. And it's developing this stepping back, this noticing the mind, rather than constantly being entangled in the thoughts that arise. That is really a key skill for everyone to learn. And really it's very, very hard to have good mental health and a settled mind and really feel grounded and in control of situations if your experience of life is just being carried along on this river of continuous thoughts and mind wandering. So that's why we're interested in that. And then finally, just take a moment to notice your breath. So if you're an average person, you're going to be breathing somewhere between 12 and 20 breaths per minute. And in all the yoga classes and protocols that we teach, we are enabling people to develop the skills and the confidence to reduce their breathing rate down to 5 or 6 breaths per minute. And that really is the step change. You go from 12 to 20 to 5 or 6. It's a huge difference. And when we do this slow, mindful breathing at a rate of 5 to 6 breaths per minute, it has an instantaneous and transformational impact on everyone who does it, which I hope you will experience now in a moment. First thing I'm going to do before I bring that breathing ball back in is just get you to place a palm on the abdomen. And this might work better for you again with the eyes closed for a moment. And as you breathe in, try to relax the tummy and allow the belly to swell a little as you breathe in. And as you breathe out, feel the belly recede a little. And the second check would be to place the hand about halfway up the rib cage and just check that the rib cage is fairly passive. So we want to feel movement in the lower hand, the belly moving in and out with the breath. We want to feel very little movement in the ribs. And the reason for that is simple. We want to be breathing with our diaphragm and not breathing with our intercostals. Our intercostals are really useful for getting air in and out of the body rapidly when we're doing sport or we're running or anything like that. But it's a really bad idea to breathe with them as a normal breathing pattern. And if you have that, and you get that with stressed people get so stressed that their tummy knots up, and so their diaphragm can't move down. So the diaphragm sort of squishes out, pushes the lower ribs out, and the intercostals lift the rib cage. And so we call that reverse breathing, where you've got people's tummy moving in when they breathe in, because the rib cage is lifting and widening, and moving out as they breathe out. So you've done that little check. You can relax the hands down or place them back there whenever you want to, if it's helpful. And then beginning to breathe in a slower rhythm now. So I'm going to give you a cue with the breathing ball. Breathing in and breathing out. We're going to work into this, not going straight into 5 to 6 breaths per minute. But what we are doing is just slowing and smoothing the breath. And we don't do deep breathing. We don't call it deep breathing. We don't call it big breath or the biggest breath. The most you want to feel really is a comfortable fullness of breath. After all, we're not doing sport. We don't need to hyperventilate. If we overbreathe, we're likely to feel a little bit lightheaded. Could be a negative effect there. But if we're breathing to a comfortable fullness at this slow rate, we're doing plenty enough to provide all the oxygen the body needs. And in fact, it's more efficient to breathe less often and more slowly, because you have less time drawing air in and out of the conducting airways, where no gas exchange is going to take place anyway. Now, if you're not breathing in and out through the nose, have a go at breathing in and out through the nose, which is what we encourage. Of course, if your nose is blocked, you'll have to use the mouth. That's absolutely fine. But what we can do then, if you are having to breathe either in or out through the mouth, you can just purse the lips a little bit to reduce the flow of breath. That will help to slow the breath down. So we're step by step moving into this rhythm of inhaling for 5 or 6 seconds, exhaling for 5 or 6 seconds. So this first practice is equal breathing. The inhale and the exhale are pretty much the same length. And this breathing practice is very well evidenced for maximizing heart rate variability. It's also pretty calming, but it's not as soporific as the second practice I'm going to teach you. So this is one we would use in the morning, during the day, or any time when you didn't want to do a kind of bedtime routine. Having said that, if you're feeling really stressed, the long exhale that we'll do in a moment is really good. So next time you exhale, just let your breath settle into its own natural rhythm. Just take a moment to notice any effects of that breathing, any different sensations in the body, any shift in the mind. Because it was around about 300 BC that the sage Patanjali wrote the Yoga Sutra. It was really set out as a practical expression of Samkhya philosophy. So it's more a psychosocial treatise than a spiritual treatise. And it's really a superb, pithy, condensed dissection of the mind and how difficult it is to calm the mind and how tricky it is to meditate unless you have a settled mind. And we can deduce from this text, which is the foundational text for all yoga that has followed, that the main purpose of yoga is to steady the mind and make it very, very calm, to reduce the amount of mind wandering and to prepare the mind for meditation. Okay, let's do breathing practice number 2, and then I'll show you my little bit of office yoga, chair yoga that you can hopefully enjoy and find that even with 5 minutes you can have a major difference to how you feel in your body. So this is both the breathing practices we teach, even though they're superbly well evidenced, are really very, very simple and accessible to everyone and very safe. So in this breathing practice, we are attempting to have a longer exhale than inhale. So with our 5 to 6 breaths per minute kind of goal, long-term goal, that means we want each breath to last about 12 seconds. So for this one, it would be something like inhaling for around 5 seconds, exhaling for around 7 seconds. So we'll just begin to breathe again with the breathing ball, inhaling preferably through the nose, and exhale. Just let that exhale lengthen a little, stretch the out breath. When you're ready to inhale, comfortable fullness of breath, quality and flow. Long exhale. Inhale. Long exhale. Just keep on going, because everybody's breath is individual. You haven't had the benefit of building this up over several sessions. You're just dipping your toe in, trying it out. There should be no feeling of strain on the breath, no feeling of not getting enough breath. And if you can achieve those things and also just have this feeling that your exhale is longer, it really has all the time it needs to exit the body, it dies away, the inhale naturally arises. If you can achieve that, you'll begin to feel probably the relaxation response being particularly strong during that exhale. And it has this cumulative effect. Inhale, long exhale. Let's do 3 more breaths in your own time. At the end of that 3rd exhale, again, just release your breath into its own natural rhythm. Just take a moment to notice any different feelings from that breathing practice, any different effects on the body or the mind. And what we know from the long exhale is that the heart rate variability thing comes in here. As you breathe in, it's slightly associated with sympathetic drive. Heart rate speeds up. As you do an exhale, vagal nerve is stimulated. That sends out the signal, slightly inhibits the heart rate, slows the heart down. So you've got this lovely waxing and waning of the heart rate, speeding up on inhale, slowing down on exhale. But because that vagus nerve is being stimulated with the long exhale, that stimulates the parasympathetic side of the ANS and leads to the relaxation response. So we recommend this for people who are feeling stressed or anxious or find it difficult to sleep or wake up in the night. They can do the long exhale. And we do actually teach a technique that helps with the lengthening of the breath process that I don't have time to share with you tonight, but you will know, some of you may have even already been on the Yoga for NHS staff wellbeing program, but it's free of charge. I'm taking enrolments all the time. Just drop me an email and I'll put you on the list for the next course, which starts on the 5th of June. So let's do a little bit of practice. So if you are happy just to bring the hands together in front of the chest. So I've sort of come back into that neutral spine. I've tucked the chin in a little bit. I've brought the head back over the center of the body. I've lengthened the back of the neck. What we don't want is that kind of chin jutting position with the back of the neck getting crunched there. And then as you breathe in, just taking the arms away from the body. And as you breathe out, bringing the hands back together. So this initial practice is to remind us that when we do a yoga practice, it needs to be synchronized with the breath. And even better, it needs to be led by the breath. And that is what distinguishes a yoga practice from physical activity. You know, you could go to the gym, go on the treadmill, do anything like that. It's not a mindfulness experience. This is a breath-led practice. That's what makes it yoga. So last one, if you've been quite static today and you want a big stretch of the last one, inhaling, take the arms as wide as you want. Exhale, bring the hands together, and then let the arms hang, give them a shake. Let's just go with the shoulders again, breathing in, forward and up, breathing out, back and down. So what we do with the patients and with the staff is we have a breathing practice for every single week. Sometimes the same one will continue for a couple of weeks. And we remind both patients and staff at the beginning of the session, do a little standalone breathing practice, but then that same breathing practice is threaded through the whole class, re-practiced at the end, encouragement to practice at home. This is how the breathing practices really get embedded, and we've had loads of fantastic feedback from staff who are using our breathing practices in the workplace, just walking from patient to patient, from ward to ward, just doing a little bit of mindful breathing up and down from the ground and really feeling that they can center themselves by doing that. So one more shoulder release, fingertips towards the top of the shoulders, breathing in, take the elbows forwards and up. And as you breathe out, take the elbows back and down. 2 more times, breathing in, forward and up. Exhale, back and down. And last one. Any shoulder injuries or restrictions, just make it your pain-free range of motion. That's always what we want to do. And then breathing in, I'm going to invite you to take the right arm up into the air, and at the same time just press through the right foot and stretch up on an inhale. And then as you exhale, leaning over to the left, bend the elbow, rest the wrist on the crown of the head. And for the next 3 breaths or so, as we breathe in, we're just slightly pressing through that right foot on the inhale and actively lifting this elbow and making this right side of the body as long as we can. And as we do the exhale, let's say we're working with the long exhale, as you do the exhale, you soften into the side bend. So we're not pushing ourselves and trying to make that stretch longer by forcing it. Instead, we're using the long exhale just to invite a softening and a release. And actually that long exhale works very, very well with the way the neuromuscular system works in terms of switching off signals from stretch receptors and muscles. It's a very, very efficient way to lengthen tight muscles and create space in and around joints. On your next inhale, reaching up, and as you breathe out, lower that arm down, let the arms hang, give them a little shake. Now, you won't be able to see, probably because you're not in front of a mirror, but that shoulder is lower than that shoulder, so the one I've done. So we've got to do the other side now. So breathing in, the left arm is coming up. We're pressing through the sole of the left foot. We're stretching up and then exhaling, side stretching to the other side. So all the literature in the yoga tradition is all about, yes, you must have a daily practice. You need to stick at yoga for a long time if you're going to have, if it's going to have sustainable long-term effect. And they were really talking about very complex and high-level spiritual goals there, of kind of reaching a state of bliss, superconscious state. But actually the experience of doing yoga is that in a few moments, in a few breaths, a stretch here, a stretch there, you can make, there's instant rewards to be had as well. That's all I'm saying. Breathing in, stretching up, breathing out, long exhale, softening into this left side of the body. And then breathing in, reaching out, breathing out, release. Give the shoulders a little lift and roll. So I'm going to get you to bring the hands back together again, but this time I'm going to get you to squeeze the palms together. But as you squeeze the palms, don't let the shoulders creep up, keep them back and down. And then as you exhale, turn clockwise. So turn the shoulders and the head around, and then release the hands down. So from the clenched hands position, just drape the hands over the outside of the right thigh. Shoulders are turned to the right as far as they will go, and the head too. I'm not going to turn my head away from you because I'll be away from the mic. So you're going round clockwise as far as you can, head and shoulders. Each time you breathe in, think about lengthening up through the axis of the spine, lifting from the center of the pelvic floor to the crown of the head. And each time you exhale, just softening into the twist. Don't try and pull yourself around or force it. Just soften. That's all you need to do. On the next inhale, keep the shoulders there and turn the head. So now the head is trying to rotate around to the left. Shoulders are turned to the right. We've got a contrary twist. This is very freeing for the spine. Very useful. Also gives you excellent feedback on the amount of rotation you have in the thoracic spine and the amount of rotation you have in the neck. On the next inhale, coming back to center, squeeze the palms. Notice when you squeeze the palms, your core engages. The spine sits more erect, you get a little bit taller. Exhale, going round onto the other side now. Turning the shoulders, turning the head as well. So both head and shoulders going round to the left. Breathing in, lengthening up, breathing out, softening into the twist. One more breath, and then on the next inhale, leave the shoulders there, turn the head. So you're looking back towards the front of wherever you are. So shoulders are still rotating round to the left, head is turning to the right. See how that is. Does it feel different from the other side? Wonderful. And then breathing in, coming back to center. I'm going to counterpose that movement by a little bit of cat stretching. So I've stood up now, and I've got my hands resting on the chair, but I'm not putting too much weight into the chair. Most of the weight is in my feet. I'm going to risk getting up and come back a little bit, and hope that, because I'm not using I usually use a lapel mic, but this platform wasn't so happy with the lapel mic, so I'm on the one here. So you've got a bit of a better view now. So knees are nice and bent. So notice my spine is long and neutral. And then breathing in, we're going to roll the shoulders back, open the shoulders, and you kind of have to stick your bottom out a little bit. And so we're trying to create an inward curve to the spine. And as you exhale, tuck the chin in, tuck the tailbone under, arch up the back. So round it up towards the ceiling. That's exhale position. Inhale, big bend in the knees. Feel the pelvis moving, create the inward curve. As you exhale, straightening the leg, tuck the tailbone under, tuck the chin in, arch up. And then just undulate 2 more times with your own breath, breathing in and breathing out. So when you do this, you move over 69 joints in the spine. So it's a really, really effective way to keep spinal mobility. And then when you've done that last one, we're just coming into the downward dog. But again, using the chair. So again, very light hands on the chair. And this time I've got the hands nice and flat and spread. And then we're going to keep the knees bent and really stretch the hips away from the fingertips and have this lovely flat back. And this would be downward dog. So if you took the chair away and I place my hands on the floor, we'd have a more classic downward dog, but we're not doing that this evening. Okay, hopefully that went okay. Obviously I can't see you, so I just have one more thing for you to do, and then we'll sort of wrap this up with a little bit of discussion and some questions. So I like to use the chair as a prop, so I've got one more thing for you. If you are going to do this, you need to have a chair that's not going to slide around, because we're going to take one leg onto the chair. My head's going to disappear here, and I'm just going to work the foot back on this one. So my chair's nice and steady, and I can hold the back of the chair, so I'm really steady. And now I can go into this lunge position. And I wanted to show you this. You could place the chair against the wall as well, or even in the corner of a room, and have the wall to place the hand on too. So if you're in the right position, you haven't turned the back foot out too much, you're probably feeling a bit of a stretch through the calf muscle of the back leg, and crucially this stretch through the front of the hip and the top of the thigh of the leg that's going back. And the one that's on the chair, it's a nice position for a bit of hip opening. You can stay there for several breaths, and then you could do the other leg. Now, those of you on this session who already do yoga or are quite well acquainted with different disciplines of physical self-care, you might already know what I'm about to say, which is that, and then just a couple more breaths and then coming out of that, is that when we're teaching, whether it's patients or staff, we really want to address the epidemic of things that are happening in society due to low levels of physical activity and due to chair sitting. So we would always be opening the hips. We'll always be stretching the hamstrings because they get very short from sitting in chairs. And the other thing that gets short sitting in chairs are the hip flexors. And that's where those lunges come in really, really handy. So the back leg, they're really lengthening through the hip flexors there. And that's a crucial one to keep from getting too tight, because when you've got tight hip flexors, because the iliopsoas attaches on the lower back, goes across the hip joint and then to the top of the femur. If that gets tight, then you start to do things and the lower back gets pulled around, and that's exacerbated where there is a lack of core strength to support posture. Okay, so that I've only left 5 minutes, but I'm very happy to take any questions or comments. I should be looking at the chat now.